30 seconds. Yep, that was the average starting point. By week 8, those same men were lasting over 5 minutes. No pills, no numbing sprays or creams, no surgeries. Just a specific combination of exercise that costs absolutely nothing, and it takes about 10 minutes per day. I'm going to break down exactly what they did, step by step, so you can start tonight. But I also need to explain why this works, because once you understand the mechanism, you will realize that most men have been thinking about premature ejaculation completely wrong way. I'm Dr. Arkady. Let's get into it. Before we get into a fix, let me reframe the problem. Because most guys who come to my office dealing with this have already been beating themselves up about it for months or even years. They definitely think everything is broken. They think it's a weakness, and that shame is actually making the problem significantly worse. Here's the reality. Premature ejaculation affects roughly 30% of men. 1 in 3 people. That makes the single most common sexual dysfunction in males. And the clinical definition is ejaculating within 1 to 2 minutes of penetration before you or your partner wants it to happen. But the real definition, the one that actually matters, is simpler than that. If you're finishing faster than you want to and it's bothering you, that's enough. Now, of course, most guys trying to solve this problem on their own. They try thinking about something else during sex, they will try slowing down, they will try numbing sprays that make them lose the sensitivity entirely. Some of them just stop intimacy or initiating sex altogether because the anxiety becomes too much. Now, unfortunately, none of those are real solutions. They are workarounds, and they don't really address the actual problem. So what is the actual problem? Most men assume that premature ejaculation is purely mental. Just relax, stop overthinking, as if you can think your way out of neurological reflex. Here's what actually happens. Your body has 2 competing systems that control arousal and ejaculation. The sympathetic nervous system, which is your fight or flight reaction, controls the ejaculatory reflex. It's the gas pedal. Then there's a parasympathetic nervous system, which is your rest and digest mode. That's the brake. In men with premature ejaculation, the gas pedal is stuck. The sympathetic system is overactive, and it pushes you towards ejaculation faster than it should. Stress amplifies it. Anxiety amplifies it. Tension in the pelvic floor amplifies it. And once you have had a few bad experiences, performance anxiety kicks in and cracks that whole sympathetic override even higher. Now, here's the insight that changes everything. You can actually retrain this system. And one of the most effective ways to do it is something you already do 20,000 times per day without thinking about it twice. And it's breathing, but not the way you normally breathe. A very specific type of breathing that directly activates the parasympathetic nervous system and teaches your body to down-regulate that ejaculatory reflex. And I'm not just theorizing here. There is a clinical trial that measures exactly what happens when the man adds this technique to their daily routine. Researchers took 62 men diagnosed with premature ejaculation and split them into 2 groups. Both groups received the same baseline treatment, which is a behavioral therapy using stop-start method, where you bring yourself close to the point of no return, then you stop, let arousal come down, repeat that cycle 3 or 4 times before allowing yourself to ejaculate. Both groups also did pelvic floor muscle training, which is pretty important. Think of it like a Kegel exercise for men, contracting and relaxing the muscles that control the ejaculation. They did it twice a day, 3 days per week for 8 weeks. Both groups were doing proven techniques, but one group additionally had extra component, diaphragmatic breathing exercise, belly breathing, and the results were remarkable. The control group, the one doing behavioral therapy and pelvic floor exercise alone, improved significantly. They went from about average of 30 seconds to 238 seconds, which is amazing. That 690% improvement was just the standard techniques. But the group that added the breathing exercise went from 30 seconds to 300 202 seconds, over 5 minutes. That's 900% improvement. And they didn't just last longer. The pelvic floor muscles become measurably stronger. They could control harder and hold longer than control group. And when the research measured the heart rate variability, which is a direct marker for parasympathetic nervous system activity, the breathing group showed significantly greater improvement. Their brake pedal was literally getting stronger. Let me put it in a different perspective. A minute might not sound like much on paper, but if you've been finishing in 30 seconds, doing just under 4 minutes or 5 minutes is the difference between frustration and actual connection. Often it's enough to change how sex feels for both partners and how you feel about yourself. Here's how to do this exact exercise. There are 3 components to it. The breathing. Sit up straight or lie on your back. Place both hands on your lower ribs, right where the rib cage meets the abdomen. Breathe in slowly through your nose for a count of 4 seconds and focus on letting the belly expand outwards. It's a belly breathing, remember. You should feel your hands being pushed apart. Then you exhale slowly through your mouth for about 7 to 8 seconds, so double the time you inhaling, letting your belly flatten back down. Do not breathe into your chest. The whole point is engaging your diaphragm, which works together with the pelvic floor muscles. You do 10 to 15 breaths twice per day. For breathing component, this is as simple as it gets. Morning and evening. Takes about 3 minutes total. Now the pelvic floor training component. Find your pelvic floor muscles. The easiest way to imagine you're trying to stop urine midstream or trying to hold back the gas in crowded room. Those are the pelvic floor muscles that's responsible for that. Now practice contracting them without clenching your abs, glutes, or your thighs. Just the pelvic floor alone. Contract, comes up, relax, and melt, comes down. There are 2 sets to it. First, do slow contraction. We're gonna squeeze for 10 seconds and then relax for 20 seconds. 15 repetitions. Then switch to quick contractions. 1 second squeeze, 1 second relax. 10 repetitions. That is 1 session. Do it twice per day, 3 days per week. Now I want to be upfront. A lot of men trying pelvic floor exercise on their own don't get good results. And the reason is usually one of 2 things. Either they're squeezing too strong and they trying to overload the muscle without realizing it, or the pelvic floor is actually too tight already and not just too weak. They need to learn how to relax the pelvic floor, stretch it just as much as they need to learn how to contract it and control it. Now this distinction actually matters a lot. In my clinic, for example, I do offer a full pelvic floor rehabilitation program where we actually assess exactly what is going on with the pelvic floor muscles, whether they need to be strengthened or they need to be stretched and relaxed, or both. And we build a protocol around the patient's need. I also developed something called the tight pelvic floor protocol specifically for men who are chronically clenching without realizing. I will put the link below so you can get a consultation if you need to. Next is a stop and start technique. This one you practice during sex or during the masturbation. Bringing yourself up to maybe a 7 or 8 on that arousal scale, and at that point you just stop all stimulation. Let your anticipation of arousal drop a little bit down to about 4 or 5, and then you start again. And you do it 3-4 times until you allow yourself to ejaculate. What this technique does over time is teaching your brain where that edge actually is. Most men who ejaculate prematurely have no awareness of that buildup and when it's going to happen, where the edge is. They go from 0 to done with no warnings. So this actually retrains the signal recognition. You start to feel that wave coming earlier and earlier, which gives you a good timing to start breathing, maybe to relax your muscles. Now, why does this combination work? Each of these techniques does something useful on its own, but the reason the combination outperformed the individual components in a study is because they attacked the problem from 3 different angles. The stop and start technique retrains your brain awareness and arousal. The pelvic floor exercise gives you physical control over the muscles that regulate ejaculation itself. And the diaphragmatic breathing calms the nervous system down and retrains your brake pedal. And of course, it happens over the period of time. So most men that only try one of these methods at a time get some results and they give up. The study shows that combining all 3, that produces the really dramatic outcome. Now let me tell you what you should realistically expect. You're not going to see a 900% improvement in 1 week. That just doesn't happen. The men in a study retrain consistently for 8 weeks before the number shows up. In the first 2 or 3 weeks, you'll most likely be learning the mechanism, getting the breathing properly, figuring out which muscles to squeeze on the pelvic floor, building that habits. Around week 4, most men start noticing their awareness during the sex. You will start feeling that build up approaching sooner than you used to. The awareness is there. And by week 7 to 8, that physical control starts to catch up with the awareness. The other thing I have to be honest with you about is this is not one-time fix. If you stop doing your exercises, the benefits will slowly fade. The same way you lose muscles if you stop going to the gym. But the good news is once you create that foundation, once you build the foundation, maintaining it takes significantly less effort than building it from scratch. My friends, everything I just described to you is absolutely free. It takes 10 to 15 minutes per day. It requires no prescription, no spray, no side effects whatsoever. And this was measured in controlled clinical trial, not some gimmicks or placebo. If this changes your life even a little bit, please share this video with someone who may need it as well. Because most men dealing with this will never bring it up with a doctor or friend or partner. Sometimes the video is the only way the information gets through to them. And of course, subscribe if you want to get that notification about new videos that come up every single week. We'll see you in the next video and best of luck.